Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we are here to bring you an entertaining show about all kind of things. But today it is...
Rabbit trails.
Yes, specifically titled, Vitamin D and Fish Oil Doesn't Work, really. And this is based on some research and articles and...
Bull.
Okay, things that came out this past week about fish oil and vitamin D really didn't do anything for heart health. And Dr. Lewis would like to throw in a little bit of his analogies and information.
And Janet's sitting there quivering in her seat.
To possibly dispute some of these findings.
Possibly, yeah.
And we also would like to educate you today about some things that you can take in different stages of your life, as far as when you're younger and female and male and middle-aged and specifically the elderly, and what do they need to do, because there's so many out there that think they're being overdosed on vitamins, and are they really working? And that's a great question, which goes back to our vitamin D and fish oil really working. So without further ado, Dr. Lewis, can you help us understand why these articles are written, and why would they tell everybody that this stuff doesn't work, and what makes your thoughts on it so different?
Well, people say, well, you're in the business of selling supplements. They say, yeah, well, if you could eat a healthy diet, I'd be out of business, and I'd be okay with that. I'd be, super successful as a chiropractor. I could go back to that, no problem. But some of these studies are put out because there's other entities that back these studies that want to make sure they're driving an agenda. Everybody has an agenda. The question is, you have to have the discerning spirit or the wisdom to decide what is correct and what is not in your best interest. I've said this before, and I'm going to say it again because I think it's pretty brilliant, and it's not my thoughts. I just kind of pick up on it and elaborate. And Janet's over there like, oh, God, I'm so afraid of what he's going to say today, because I'm a little hyped up about the BS. BS stands for belief systems.
He's been like a horse chomping at the bit just to get on here and talk about this.
Well, the real truth is she's giving me the afternoon off, so I'm going down to the deer lease and see if I can shoot a pig. But I get excited about that. The thing about vitamin studies... Well, golly, it's such a big subject. I'm afraid I'm going to go down plenty of rabbit holes. Thank you for those that are tolerant of that. What happens in some of these so-called meta-studies, especially the ones poo-pooing vitamins, have you noticed that's happening more and more? They're poo-pooing vitamins and minerals. Who is it that has the most to lose? It's the people that are selling drugs, because if you get a healthier society, there's going to be fewer drugs needed. And I'm not against drugs. I love our medical profession. You've heard me say they bail me out more than once. They're very good people. They're well respected. They're very intelligent, and they're well intentioned. But what if your body, it's designed by God, and it can take its vitamins and minerals and do good things with it. So some of these studies I'm going to talk about, there was one that they reviewed 747 trials. Okay, you think, well, what did the 747 trials say? They only took 68 of the 747 because those were cherry-picked to show what they wanted to show. Not the truth, but what their agenda was. And so they call it a meta-analysis. If it's really a meta-analysis, why did they throw out all but 68? These trials were skewed. They were skewed toward the elderly, which I've said this before. I think it's really cute. They skewed it toward the elderly because they were already closer to the pearly gates. Some of the mean age in these studies were over 80. One of the participants was 103, and these were cherry-picked to prove that vitamins are not good. So, 80, for God's sake, that's above the average age where the American dies. So, these particular people had heart disease, cancer, cirrhosis of the liver, kidney failure, arthritis, diabetes, cataracts, Alzheimer's. They had cataracts, so they couldn't see it coming. They had Alzheimer's and Parkinson's. Many of the heavy smokers, of course, they were included in these studies because you can't take enough supplements to offset heavy smokers. Now, you can slow down the degenerative process. They had plenty of people that had pre-malignant conditions, and many of these people were actually in the nursing home. Okay, so they threw out the health nuts, like me and Janet wouldn't make the skew there, and 68 out of 747. That's just the same thing they did with global warming. They cherry-picked what they wanted to prove because 97% of all climate scientists say global warming is, it's only about 1 degree different, and that's a normal variance. And they cherry-picked and they threw out the studies from Siberia, which would, that's the cold study, so they threw it out to make the world look a little hotter than what it is. Anyway, they do this with vitamins all the time. And, one of the ways that they skew these studies is they will put you on a bad vitamin or a very, very low amount that couldn't possibly do the job in the very short time that these people are studied. Like one of the studies, they put you on vitamin E, but it was only 10 international units. Okay, folks, that's not enough to do any good. And most of these vitamins they put you on would be like a DL, alpha tocopherol, which is not the right type. It will not work. Some of them actually gave the participants 5,000 IUs, which is about 4 times what you should take ever. 5 times, something like that. Some of these were only given for a few days or a few months, and yet they thought it was a good study. That's how, because they got old people that were full of diseases, gave them bad vitamins, not enough vitamins, too much into the toxic range of vitamins, and then decided it didn't do anything for your health. Now, if you didn't throw away some of these studies, it actually showed that people had a much lower mortality rate if you were taking vitamins. And again, you have to ask, were they good ones? And there's a lot of mediocre vitamins out there, and there's a lot of not very good ones at all. So I hope talking about the pearly gates, kind of answered that question.
Well, on their side, to help their little study of what they found, they could be very right, because they really could have given the patient a very inferior product. Because how many times have we run lab? And, for those of you that are new to listening to our show, that's exactly what we do, is we run low-cost lab work so we can see what's missing with your nutrition. And there have been, I can't tell you the people that we tell them, take a good fish oil, because on lab, we can see when you've done a good one, because it helps lower triglycerides on the cholesterol. It makes the cholesterol look better. And people will come back and they'll go like, yep, I've been taking that fish oil. And I'm like, well, why are your triglycerides still not any better? And it's because they decided to get a lesser quality of one that doesn't work well. So they very well could have been given some over-the-counter fish oil or vitamin D. We've seen that work with vitamin D as well. They'll come in and tell us I'm taking 5,000 IUs of vitamin D every day.
93% of what we see, people taking 5,000 of vitamin D, 93% of them are not working.
Right. So they I doubt they gave these people the best of the best products of what we use to move lab work. So right. They very well could have given them an over-the-counter, both of those, and it didn't work. It didn't do anything, because on our lab we see it doesn't do anything either. Oh, well, that's a good point, because one of the research articles I probably won't get around to
is about how you can take too much fish oil, but it's the wrong fish oil, and you can get a buildup of methyl mercury, which can actually cause tremors and contribute to neurodegenerative diseases. That's like your brain goes down, like Parkinson's, Alzheimer's, and that type of thing. And I'd like to kind of apologize to you people. I appreciate that the fact that you share this so much, and we get so many new clients because you share. So God bless you and multiply all your good things. But normally I sit down and write a good 1, 2, 3 hour show. This one's off the cuff. So I apologize. I'm so disorganized. And Janet says, well, what else is new? Well, I'm more disorganized than normal because I'm leaving in about an hour and go try to shoot a pig. So I know. That sounds bad, doesn't it?
What is funny is he actually comes into this setting with 4 to 5 books, and when he tells you he's been sitting and reading and coming up with things for the show, he's not telling you a story at all.
And real research, too.
But to tell you that he makes it through a fourth of what he brings in here for each show would not be the truth.
Yeah, it's not even close.
So he feels better that he comes in with all of this material ready to go, and his stuff is always off the cuff. So.
And I don't have that prepared today, so y'all just rabbit trail number 14 or something.
He's not very scripted to start with. I don't think you can script him, and that's what we love about him. He does not fit in a box. So.
Oh, yeah, there's an inside joke on that one, but go ahead.
So do you want to explain vitamin D?
I'd love to.
Oh, yeah, okay. Go ahead. Tell us about vitamin D.
You can't get enough out of the sun. Well, why not? They did hundreds of years ago. Of course they did, but you weren't full of plastics, pesticides, heavy metals. You didn't get that load of benzene from your carpet. You didn't get that load of benzene, 200 years ago from filling up your gas tank. You didn't get the fire retardants out of your pillows and mattress last night. So, and then we've got people that in incredible wisdom wants to lower the holy heck out of your cholesterol. Well, duh, it's high because you're eating trans fats, hydrogenated or partially hydrogenated fats. You're eating too many sugars and carbs. It's not the fat, folks. It's the type of fat and the sugars and the carbs. And it's because you've got a GI problem, you've got a thyroid problem, and you've got a liver problem. And so you don't have, now you're lowering all that cholesterol, and you've got to have cholesterol to convert sunlight to vitamin D. Duh. For example, I've got a little bit of research here. I'm sorry, most of this is off the cuff. There's a article from Journal of Neurology that says the incidence of multiple sclerosis. Now, would y'all agree that's a pretty bad diagnosis? That's like a holy crap diagnosis, and you go into fear. MS is lower in the tropics and increases with the distance from the equator in both hemispheres. That means they're getting more sunlight, converting it to vitamin D better than we are. So the sunlight exposure exerts a protective effect against MS, and that's a horrible diagnosis. Or maybe it's piranhas around the equator that protect you from MS, not vitamin D. You could say, well, that's a correlation. There's piranhas down there, and there's not piranhas up here in Texas. No, it's the sun instant. And that's what people do when they skew these studies to try to manipulate you into not getting healthy by taking supplements. They'll highlight a correlation, not a causation. So I've always implored you people to think, and thank God you do. I mean, we've got an incredible business here. We've got people that are just going on and on and on. Oh, I want to get my husband in. I want to get my cousin in. And we get referrals several per day. So thank you very much. Women that use supplemental vitamin D had a 40% lower risk of MS than women who did not use vitamin D supplements. Don't get me started on vitamin D and autism. I doubt I'll get there. Vitamin D has a strong immunoregulatory effect, immune system, folks. And we're getting kids in here that have a horrible, horrible immune system or autoimmune disease. We have kids that are having awful skin problems. Their hair's falling out. They get sick, stay sick, and and I'm all for the drugs. I have an MD, love my MD. I've used osteopaths a lot. They're usually very, very brilliant and easy to talk to. But folks, drugs are to bail you out of a crisis, not a long-term fix. And I've seen people on prednisone long-term, and boy, the side effects is horrible. You should have seen this lady my age the other day that's been on it, and holy geez, what it did to her skin. There was a study done at Harvard School of Public Health that said high levels of vitamin D is an immunomodulator and decrease the risk of multiple sclerosis. Well, hey, you just said that. No, I'm reading another study. Okay? They both said the same thing. And one of the things in this study says among whites, there was a 41% decrease in MS for every 50 NMO per milliliter or per liter increase in vitamin D. Well, why do they say white? Isn't that racist? Well, first of all, white people absorb more sunlight and convert to vitamin D than blacks, because there would be a much different percentage if you did that on black people, especially the ones with the darker skin. So having real dark skin is actually like putting on a 40, is it SPF sunscreen? It's a 40. So the darker you are, the more you need to look on lab what your vitamin D is. It's very, very, very important. You can see the soccer players and football players that snap their bones in a position that doesn't seem like it should snap. They're almost always the darker skinned people. So I'm not meaning to be racist, because we grew up with all races, never thought there was a problem there at all. But these are good studies, and I can go on and on and on, but I'm going to mess around and get stinky and go to fish oil.
Yeah, fish oil, a good one that actually works. And, we talk about that. Well, how do you know it's a good one that actually works? It should be a very high ratio of EPA to DHA. That's what makes the difference, because you'll see a lot of them out there. People come in here and they're like, "Oh, I'm really taking a great one. It's it's the best that you can buy over the counter."
Well, who snookered you into believing that's my question. What was it that sold you, that made you believe something that was not true?
Commercials.
Well, that's why I drank Coke instead of Pepsi, right?
But our Orthomega 820 contains 430 milligrams of EPA and 390 milligrams of DHA per soft gel. So that's a very high ratio, and that's what actually makes it move triglycerides.
Oh, but
what?
This one is a triglyceride ester, and it's 393% more absorbable. Yes. And this lady about my age came in with horrible skin because of the prednisone, and she was taking another fish oil, which from the health food store is one of the better ones. But I said, well, why is your lab still really, really boo-booed? It says it's a triglyceride ester. Is it really? Folks, I know you don't believe it, but some people will lie to you. Oh, yeah, you've had a crazy ex, so we've all been lied to, hadn't we? Well, it works that way in advertising, too.
Yeah, but a really great fish oil can help with heart health, believe it or not.
I've got some research on that one. Woo-hoo!
Good. Do you have it available, or is it like 4 books down?
Yeah, well, let's say I'm pulling it out of my
file cabinet. Yes, or file cabinet.
This is from Journal of Molecular Cellular Endocrinology. Yeah, that's a mouthful. It says minerals, okay, that would probably mean magnesium, and essential fatty acids help the thyroid, which help the heart. Now, okay, so, we heard on Good Morning America. I don't believe anything George says because he distorts the holy heck out of everything. I'm keeping it clean, believe it or not. But, folks, I try to do this, and I try to teach you to think for yourselves. And Janet has something, maybe I'll just read it, if I may.
A question?
Yeah, you can do it, because I want to get to this one.
Okay.
It makes sense to me.
again, we were going off on what fish oil did, but we're off to a question now.
Rabbit trail. Sorry, folks.
This question is from Donna. He likes this because she said she's a devout fan of our podcast. So thank you, Donna. We love you too.
More than you know.
And she appreciates our no-nonsense and simplistic style of teaching us about health. Does that mean that we're very elementary-minded, or it's just easy to understand? We'll go with that.
I thought she called me a dumb Texican, but I think it was a compliment.
Her question is, for the last 5 days, she's been having shortness of breath when she eats and only when she eats. And do you have any ideas what could cause this? And she doesn't have any other digestive symptoms. And this sweet lady is out of Canada, so yay. I mean,
yeah,
that's
we
pretty
can't.
cool.
Well, we can't get supplements there, which bothers me. But probably a food allergy. And one of the things I found out is sometimes we have allergies to foods that we normally would think of as healthy. I tested, to produce antigens against coffee, and I told Janet, I said, well, that sure as heck ain't going away. And I said, I'm produce antigens against avocados and walnuts. And it's like, well, I like them both, but I do a lot of them just because I thought they were healthy. So I told her, shortness of breath, see your heart doctor. And, you can check for allergies, have your chiropractor check, you may have a hiatal hernia, and then talked about we can run lab. And she said, thank you, just had my food sensitivities done, been changing her eating plan, which I think was good. Didn't think was hard. But she says she's in Canada, so she'd have to find labs here, but thank you for your advice. The thing is, I did a podcast with a guy the other day that's from Canada, and he says if I changed general physicians, it would take me a 3 to 4 year waiting period to get that. He says, I'm in a area that's the size of Maine. He says, in this area we have 3 MRI machines, and in Maine they have over 600. That, folks, is where we're headed with socialized medicine, and that's why Janet and I are getting busier and busier and busier, and there's a lot of other people that do the functional nutrition or functional medicine. It's because more people are realizing you have to take responsibility for yourself. People say, does Medicare cover it? I said, no, Medicare don't cover diddly squat, so I'm not going there. Health.
But you need to mention your lab, because no, they don't cover it, but we also have our prices so affordable. That's why you can do it, because you don't need insurance. We've literally cut out that because we don't take insurance. We can basically run more lab panels. We can do them for a much less cost. I think right now our comprehensive panel with 12 lab panels in it's $298, and that covers Dr. Lewis's time to go over it. It covers the 12 panels of lab. It gives you a functional medicine report. It gives you supplement recommendations about what he's wanting, and you get up to 30 minutes with Dr. Lewis to go over it. That's a heck of a deal. That's about a $3,500 lab right there.
And I get a lot of people from California, and I say, geez, I'm a slow, drawling Texan. Why do you do that? And they say, well, it's obvious you know what you're doing, and you don't charge Hollywood prices, so maybe I should go up. I don't know. I just assume you just take our supplements, let us help you be guided into better health. So, that's kind of my goal.
And how do you get those in California? It's because we can send you to your local Quest Diagnostic Lab and have that drawn. So we can literally help anyone across the United States, and we do it all over the phone. We do it via Zoom, where Dr. Lewis can talk to you in person if you'd like.
I got a beautiful face for audio. For those of you that brave, you can that are really brave, you can get me on video.
Yeah, so there's no reason why you can't know what's wrong with you. I mean, that's what we do. That's our goal, is to teach and educate and help you get better. And we had another question from a young lady that said, hey, there's so many people out here selling these packages of products now. I guess they're based on people's ages, like you're female and you're 20. They're selling you these prepackaged vitamins of what to take. And her question was, can you talk to us a little bit about, if you're in these different age brackets, what would you recommend for for these people to take? How would you break that down, Dr. Lewis? What would you recommend for the stages of your life? Male, female, does it matter? What really do they need?
There are some variances. When you're young, I think you need a different type of vitamin. We have some that seem to be pretty popular. Even our finicky grandkid that's 5 will take them. I love her dearly. She's got Papa wrapped around her little finger. But as you get older, you need something different when you're a teenager. You need more adaptogenic herbs because of the stress of being a teenager, torn between, being a child and a woman, as the song goes. I think it was Strawberry Wine song. But as you get into it, it depends on your job too. Women usually need more iron, but don't take iron unless you see it on a lab. But women usually need more iron because of the menstrual cycle, and that deletes a lot of the blood. But men need more, depending on what you do. We just had a dear friend of mine that's got myasthenia gravis because he was a welder and he's inhaling all those welding gases. And I've talked about research before about welders have more Parkinson's and Alzheimer's and MS because of the excess toxins. And we see that pattern in people that spray pesticides. We see it in nail techs and hair cutting ladies, whatever you call them. Ones that have a higher intake of chemicals need more detoxification. That's another thing. This is kind of off the cuff again, but I read a thing on the internet the other day. It says detoxification is a farce and a sham. You can't detoxify at all. And I thought, well, what an idiot, because if you couldn't detoxify your body, you'd never make it to birth, because you've got to have detoxification pathways. And the increase in supplements or nutrients can make a major contribution to that.
So what you're saying is, even though they're selling these packages of prepackaged vitamins, that's not really the whole story, because you really need to know, what the person's lifestyle is that is going with the person. I guess that's why we do lab, because there's so many factors of what someone needs. It's not just real cut and dry of, hey, take this multivitamin and off you go, because there are lifestyle issues, stress, like you said, job issues, and you don't know what it's doing to the body. But if you want something in general, we do have one that's called Alpha Base Premier Packs.
Oh my God, that's been popular.
Yeah, that we're
the people that want one and done.
Yeah, we're happy that you want just a packet to put in your purse and take. You're just going to do a little bit. You don't really care what's on your lab. You're just wanting to get by and do a little bit to stay healthier.
No, that's a whole lot. So yeah, that's good.
Right. So the Alpha Base Premier Packs, they contain the fish oil that we talk about, that we personally think is good.
It makes me much more better looking for Janet.
Yeah, it has the.
Okay, that's a lie.
This Alpha Base, which is the multivitamin, this one has without iron, because again, we don't give iron unless we really know you need it, because a lot of people think they're iron deficient and they actually have too much, and it's a very harmful thing. So we just don't do it. Resveratrol is the other thing that's in it, which a lot of you have probably not heard of, the resveratrol or antioxidant thing, and Dr. Lewis can tell you about why would that be important in a catch-all.
It's the only thing out of about 500 things that they studied and said it will actually reverse aging or give you 10 more years of extra healthy life out of 500 things they studied. And people say, well, it's in grapes, so I'll just get my resveratrol from wine. And I say, well, that's great. I get my vitamin C from screwdrivers too. That's about how silly that is. And I'm sorry, I'm not getting around to a whole lot of things, but when you hear an anti-this or anti-that, don't believe it, because, Journal of Lancet says vitamin E, vitamin C, magnesium, Journal of Annals of Emergency Medicine, peroxidine or B6, zinc, selenium, sulfur. That's from Journal of the Gut, Journal of Clinical Experimental Allergy, And I do have a lot here. I'm sorry, I got about 2 hours worth, and I'm disorganized on this one, but I hope you've learned something. For goodness sake, Listen with your discerning spirit. God gave you a discerning spirit, and that's why I'd rather treat women, because they know BS when they hear it.
I think the men do pretty good too. All the men we have here do a really great job of trying to stay healthy.
Yeah. Oh, and as you get older, men, you need more zinc, selenium, and prostate care, which is the natural aromatase inhibitors. So, it changes with whether you're male, female, and stages of life and toxins. So, folks, you can be healthy. Just throw away the negative and move toward the positive, and I promise you, you can have a healthier, happier life. And if you need some help, just give us a call, and we ask that God continue to bless you for all the things you've done for us and helping others and, referrals. So thank you very much.